One of the most requested procedures for fillers is the lips. And this is probably the first area that people want to get injected. We get patients, believe it or not, sometimes even in their teens, that want us to do this for events like prom and homecoming and graduation, etc. We try to dissuade them, but you know, sometimes it's like a interesting hairdo for a special event, and we're okay with that. But lip injections is really something that 20-somethings, 30-somethings generally want, because it's a way to augment youthful beauty. And there's an art to how to do it. Of course, there's patients that are a little older that are seeing thinning of the lips or loss of lip structure, and that's kind of a different bucket of patients that have different needs for lip injections. So when we're injecting the lips, there's a lot of different things you have to think about. The way we approach lips is, number one, we inject the border with very, very small amounts of filler. And when I say the border, I mean the border between the red part of the lip and the skin. A lot of women wear lip liner. And what does lip liner do? It helps enhance what you got. It generally creates an outline for the lips. We can do that with filler with maybe 1/10 of a syringe or 1/5 of a syringe. We're not adding structure or volume. All we're really doing is we're enhancing the edges of the lip that makes your lips look bigger without actually making your lips look bigger, or without your lips actually being bigger. And that's the first way I do it. The next thing we do is the sides of the lip. First thing to lose. Sometimes the lip comes out to here, but the red part of the lip, you lose it about 1/2 inch or an inch beforehand. And that's because that part of the lip is turning inward. And when it turns inward, it's inside your mouth. You still got it, but nobody can see it. It's another easy way to inject the lip by injecting and rotating the lateral parts of the lip out, making your lip look bigger, actually back to normal, because the lips are looking smaller and turned in, and we're essentially restoring the normal lip structure. Another way to make it look bigger without over-poofing your lips. Third thing that we do is we want to really highlight what's called the Cupid's bow area. And most patients like this, of course, some patients will say, I don't like it, and of course we won't do it on them. But this middle Cupid's bow area are these two peaks in the middle of your upper lip. There are actually two folds that go up towards your nose called the philtral columns. And that area is a very important area to highlight. And when we highlight that area, we start giving people lips that look like supermodels, or people that you see at the cosmetic counter at your local department store. And it's a very good way to make lips look more enhanced, again, without making the lips physically bigger. So you notice I've been saying a lot of stuff about not making the lips look physically bigger until the very end of the injection pattern. And that's because we see a lot of duck lips, sausage lips, lips that look like somebody just smacked them in the mouth. And the goal is not volume. The goal is volume in the right places. We want the lips to look full. We want them to look luscious and kissable, but we don't want them to look poofy, right? So there's a difference, and there's a way to do it. And I think approaching the lip in a very systemic fashion and trying to get fullness in as many ways as you can without injecting, which we do toward the end, is very key to doing a good result. Let's continue on. With the lower lip, we like doing a bilobe type lower lip. And that is, we want from the center of the lip, one mound on one side, one mound on the other side. If you look at Angelina Jolie's lips back in the day, look very carefully. Those are the sort of lips she had. She had them naturally. You can see pictures of her when she was younger, and that was kind of her natural lip shape. Certainly everybody has that, but we can kind of enhance that bilobe lower lip to make it look awesome. The lower lip needs to have a slight pout, kind of a very slight turnout. That's a nice low-hanging fruit in lip injection, because that looks good uniformly on pretty much everybody, as long as you don't overdo it. Again, shaping the lower lip. How should the upper and lower lip compare in volume? The lower lip should either be equal to the upper lip or approximately 1.5 times the size of the upper lip. And it just depends on what sort of look you want, but you need to really respect that ratio. If you make the upper lip look bigger than the lower lip, it looks too poofy, it looks wrong. If you make the lower lip twice the size of the upper lip, it just looks out of proportion. So we need to respect the 1:1 or 1:1.5 ratio of upper lip to lower lip. Now, finally, we're here to add volume and make the lips bigger. And it's actually the last and final step that I do. And before I go into that, we also do the corners. Sorry, missed one. Sometimes the corners of the lips turns down. We want to do some injections on the side that actually turns that frown upside down. It makes this sad-looking face into a more of a happy-looking face. Certainly, you can go up too high. We don't want a Joker look. We just want it to kind of be even or slightly above the horizontal, and that is a perfectly good-looking Mona Lisa type lip. You want to look at a very subtle smile when they're looking there. So now going into the final thing, where do you inject volume? Generally in the upper lip, we try to stay in the middle 1/3. And I think that's the place where fullness of the upper lip starts looking really good. On the bottom lip, we go to the middle 50%. So 1/4, 1/4, we try to leave alone, but the middle 50% we want to give volume to. I think if you approach the lip in that fashion, in a very systemic way, the results are very predictable and almost uniformly excellent. Lips look natural, lips look full, lips look highlighted and become a very positive feature of the face. The final thing that we do when we talk about lips is, do you inject with a needle or do you inject with a cannula? Cannulas are kind of the new kid on the block. Essentially, they're needles that are not sharp at the end. They kind of have a closed dome, and there's a little side port. So you kind of make a little stick and you just slide this, essentially this cylinder, this tube in, and when you inject, it's coming out the side. A lot of doctors prefer this because they say, well, it's not as traumatic as the needle tip going back and forth is tearing tissue. I disagree a little bit because I think if you have good technique and you know how to handle a needle will give you a great result with almost no bruising, almost no swelling. I think a cannula is kind of like a shortcut that people have developed, and certainly I do use cannulas a lot. I do a lot of training classes on cannula. If you are going to use a cannula, don't view it as a guarantee of low bruising or low swelling, because you can certainly get it. And more importantly, with a cannula, you may go in different planes. It may be deep in one section and superficial in another section. So you need to make sure that the injector is very, very experienced with cannulas and knows how to use that tool. So again, needles, cannulas, they don't make the injector better. It's the good injector that knows how to use the tool to the benefit of the patient. So a lot of variables on lip injections. I didn't even touch on products, but I wanted to focus this talk more on technique and how I approach the lip, and how we can give a great looking result in a very systemic approach. So there's lips for you.